Breathing in, there is awareness of breathing in. Breathing out, there is awareness of breathing out. Breathing in, breathing out. In, out. Where do we suffer? The physical body and psychological mind. Sexual dysfunctions and disorders, Part 4. Paraphilias. When someone can only become sexually aroused through non-human objects, animals, or without lawful consent from who essentially become their victims, then they may be experiencing one or more paraphilias. And while society, in general, might label such individuals as freaks or even monsters, it is important to understand how many, if not most, paraphiliacs are victims themselves of childhood sexual abuse or trauma, which in no way excuses them from the suffering they nonetheless inflict upon their targets. Envelope pushing. The more recognized, if not stigmatized, paraphilias include fetishism, attraction to specific objects or traditionally non-sexual body parts, voyeurism, secretly watching others as they undress, bathe, or even participate in sexual behaviors, exhibitionism, exposing one's genitalia to others without their consent, sadism, finding sexual pleasure by experiencing pain, masochism, getting off by inflicting pain on others, whether consensual or not, and frauderism, touching or rubbing one's genitalia against someone else in sexually provocative ways. Pedophilia. Perhaps the most shocking and socially reprehensible of all sexual disorders occurs when adults, mostly men, possess strong sexual desires for children or adolescents, physically, voyeuristically, and or pornographically. And many, if not most, victims involved experience potentially lifelong and even debilitating effects, since they possess little if any concept regarding the behaviors they are sometimes forced to do, that can insufferably impact their ability to form, let alone maintain functionally intimate relationships as adults. Silent screams. Many children and adolescents never report, let alone seek professional help for the sexual abuse they endure, due to tremendous feelings of guilt and shame, fear of retribution by their abuser, lack of understanding how their abuse is far from normal, let alone accepted by society, being groomed by the abuser to believe such behaviors are meant to remain secret, and, perhaps most devastating of all, a lack of believability should they speak up, especially if it involves one or both parents, a sibling, or even a traditionally trusted adult.